For most people, the brain is a black box. All you see is the skull. You don't really ever see your brain. It is your most precious possession.
Sometimes when you do neurosurgery, I said, and you said 4 hours, 6 hours, sometimes I'm like, you must be in the flow to be able to concentrate on that long. And you know, we don't think about people being in the flow that long, and then you say, yeah, I can do that. And then when I'm over, it's just...
I call neurosurgery the ultimate in mindful meditation, right? And not only am I blessed that I get to touch the human brain, but that state that people try to get in when they meditate, which is to not think about the past and not think about the future and just be totally present in the moment, that is exactly what brain surgery, and I'm sure any surgery, is like. My father was a psychoanalyst. You know, he worked with the brain in a very different way. I probably had an Oedipal complex to overthrow my father and be more aggressive, you know, in getting into the brain. That's another conversation.
Let's go there.
Right. When a neurosurgeon is working under the microscope, you're basically in a cockpit. You're sitting in a chair, your arms are supported by arm holders because you want to minimize your tremor, and you're working under a microscope, and literally the entire operation is like this. You barely even see their fingers moving. You're working in a realm of millimeters and microns because that's what you're operating in. And so you have to learn how to live in that sort of quantum realm and work in that quantum realm, and how to allow your body to do that.
I was wondering if you could say a little bit about how you go about providing hope for people and how you kind of tune that hope to the specific clinical situation in front of you.
Learning how to talk to patients is a skill that physicians acquire over time. We tried to learn it in medical school. They tried to teach it to you, and I think it's very difficult. It's this sense of being able to see the future through the scans that you're looking at. But the question is, how do you convey that information to the patient in a sensitive way and reveal it in the right way? So for example, the woman whose child had a severe head trauma, the child was in a coma, and another doctor came by and said, well, she's been in a coma so long, based on her physical exam, she's not going to recover. Just said, it's not going to recover. And by the way, dogmatic statements in medicine I always try to avoid. And so the mother, understandably, was distraught hearing that her daughter, who is 10 years old, was never going to recover. But I looked at her MRI scan, it looked good. We had evacuated the clot, it was an epidural. The brain looked okay, it looked healthy. And if the brain looks good, the old maxim I heard is like, eventually we all end up looking like our brains. You like that, Sandy? You can use that. And that's very true in neurosurgery. If you do an MRI scan and the brain looks pretty good, even though the patient doesn't look so good at the moment, they're going to get better because they're going to end up looking like the brain. And if the patient is kind of moving, but you look at the brain and there's a big stroke in there, like, that's not good, and they're probably going to get worse. So, you know, the MRI gives you a lot of information. So I wanted to tell that woman who is now despondent that there was hope, and don't lose hope. She may still get better. It was not time to crush her spirit, and in fact, she did get better. And I get a card, I get a Christmas card from that woman every year with a picture of her daughter saying, you know, this is what she did for the last year. This is what your surgery did. You saved her life, and these are all the things that she's accomplished. And those, you know, things are what keep us going as surgeons, because, you know, and make all the sacrifices worth it.